Okay.
All right, it is 5 p.m. I call this meeting of the Champaign-Urbana Public Health District to order. Can we please have a roll call?
Jennifer?
Present?
Charlene? I'm here. Danielle?
Okay. I would entertain a motion to approve the agenda. So, I'll second. Any discussion? All in favor? Aye? Aye. Thank you. It's just loud and proud. Otherwise I'm talking to myself. Okay, we have an agenda. We also have minutes from May 13th, 2026. Is there a motion to approve?
So moved.
I second. I have no discussion of them.
Oh.
Oh, you are correct. Thank you. I did skip that. Because we have it listed later on, I thought that it was.
It's at the top.
All right,
Sorry,
yeah.
I missed that too.
Well, let's start over. It's 5 p.m., 5 something now. First on our agenda, we have budget and appropriation ordinance for financial year 2027, ordinance number 2026-601. Is there any presentation? We heard this last month. We recessed until today.
This would just be the public.
Yeah. Is there anyone in the public that wishes to speak to the budget and appropriation? Seeing no member of the public, I'll seek guidance. Can we vote on this now, or we vote on it later in the agenda? That's what I thought. Okay. Seeing no member of the public wishing to address us on the budget and appropriation ordinance, we'll move on. Now, going on forward, we'll go through the whole darn thing again. Can the clerk please call the roll?
Jennifer?
Present.
Charlene?
Here.
Danielle?
Okay. Moving on, I seek a motion to approve the agenda we have before us.
So moved.
I second. Any discussion?
No.
Okay. All in favor? Aye. Aye. All right. We have an agenda. Now, minutes of the May 13th, 2026 monthly meeting. Is there a motion to approve?
So moved.
I second. Any discussion of the minutes? No, none for me either. All in favor of approving the minutes? Aye. Okay. Moving on, we have public participation. Would any member of the public like to participate now? Seeing none, we move along. Correspondence. Do we have any correspondence from our administrator?
Yes, just want to give an update on our tick-borne illnesses that we are in that season currently, and we did a press release earlier and just informing the general public about what they need to do in order to prevent themselves and their loved one. This is also the season for our West Nile virus. So our mosquito abatement program, so they do a lot of work in the community. Using larvicides in different body of water just to control the mosquito bodies in our counties. Also wanted to talk about a little bit of the cybersecurity incident and just give an update on that we're still waiting with the report of the forensic report, but we're fully functional. Everything is working as we wish. We would come back and report once we get the full forensic report, but that's just a quick update on that. We were notified by IDPH a couple of weeks ago about an environmental health spill in Rantoul, at the Rantoul food. It's a pig slaughterhouse, and there was a clot in their drainage system, and so we went and inspect, and they notified EPA and run a report, and then called Train and give us the report. So we came back and sent that report to the state health department. So everything is taken care of, but just want to give that update also. So I don't know if you know, but there is a outbreak, Ebola outbreak in South Sudan and the Congo. So since we have a higher number of residents who are Congolese, so we are coordinated all the travelers that are coming just to do a precautionary follow-up, just to make sure that everything is well. And this is a precautionary monitoring that we do in collaboration with CDC and IDPH. I would say that there's no risk to the public, or the risk to the public is very low. The restriction at the border is very high, so they're only allowing residents who are citizens, and if you exhibit any symptoms at the border, you're being isolated and making sure that you're safe before you get in. And once you get in, they transfer you to whatever jurisdictions, local health jurisdiction that you are in, for monitoring for 21 days, which is the incubation period for Ebola. So again, right now the risk is very low. We are monitoring and are part of that collaboration with CDC and the IDPH. I think that's all.
Just a few.
Yes. But yeah, if you have any questions, they can answer your questions.
I don't either. Thank you so much for the wide variety of
Yeah,
needs
I
that you
know,
handle.
I know.
And also thank you everyone here at this table and in this room for your flexibility last week when we precautionarily moved it to this week. Very happy that we didn't have any need, but.
Can I just add on top of that, another update is that during that event, our staff and our emergency management team here opened we opened a emergency shelter and allow people who were living in mobile home and homeless people in our community to come and shelter with us during the storm, just to make sure that everyone is safe. But we also did that during that event.
Did we get many people that came out?
Yes, we got a couple of individual and then a family. We found 4 or 5. Yeah.
Awesome, thank you for doing that. All right, seeing no further correspondence? Any correspondence? Seeing no further, we'll move on. We have no old business listed. We'll move on to new business. Treasury report, Mr. Fields.
Treasurer's report is as of April 2026, we have cash on hand of $7,137,496. Our total fund balance was $7,888,888. I just want to say that I don't make up the numbers, I only report them. I don't see that ever happening. That's representing 43% of our budget expenditures for the year, and so that's within the range of the 25 to 50% annual expenditures available in cash. We ended the 10th fiscal month with a deficit of $651,188, but that's against a budgeted deficit of a little over $1.6 million, so still $1 million ahead of the curve. Total revenue as of the end of April was $12.2 million, or $1.5 million under the year-to-date budget, made up of property taxes being under the year-to-date budget of $272,000. Grants and contracts were under the year-to-date budget by almost $1.2 million. Fees for services under budget by $222,000. Total expenditures were $2.9 million, or $2.5 million under their year-to-date budget for the fiscal year. Personnel was under year-to-date budget by $638,000. French benefits were under the year-to-date budget by $420,000. Contractual services under the year-to-date budget by $617,000. And patient care under the year-to-date budget by $231,000.
Have any questions? None either. Should play 8 on Romano, it sounds like. Is there a motion to place the treasurer's report on file?
So moved.
I second. All in favor? Aye. Okay. Moving on, approval of payment to Board of Health appointees. We can do these in an omnibus, if that's okay. So I would seek a motion to approve payments to Treasurer Ron Fields for May 2026 services, to Attorney Ruth Winan for legal services April 16th, 2026 to May 15th, 2026, and to Administrator Dr. Mamadou Tunkara for mileage reimbursement to Rand Whole Foods.
So moved.
I second. Any discussion or questions on either of those? I have none either. All in favor? Aye. And y'all get paid. Moving on, a review of monthly credit card statements. Any questions on that?
No.
Okay, is there a motion to place those on file?
So moved.
I second. All in favor? Aye.
Aye.
Okay. Next, we have adoption of financial year 2027 budget and appropriation ordinance 2026-6-1. We had a moment for members of the public to comment. We received no comments from the public. Are there any questions?
No.
I have none either. Y'all did a great job. We teased it out last month, and right now I would entertain a motion to approve. I second. All in favor?
Aye.
Aye. Okay, we have a budget. Moving on, approval for check request payable to Main Street Construction for fencing around 2 dumpster areas. Is there a motion?
So moved.
I second. I'm just gonna ask, did we not have this before? Was it damaged, or what's the need for this at this time?
Yeah, so I think the need was that, you know, when truck were coming to our loading dock, they were damaging, when they back up, they were damaging the walls and some of the infrastructure. So we just decided that having a fence around it would prevent that. And then also for security purposes, we just want to make sure also that, you know, people don't come and slip in there and truck like or something like that.
Is there a motion to approve?
So moved.
I second. All in favor? Aye.
Aye.
Okay. Moving on, approval of check request payable to Stocks Office Furniture for the South Break Room. Is there a motion?
So moved.
I second. I have one question about this. I saw it listed in the itemized bill there. There's tariff-related surcharge. Did they let you know if they get their money back, we'll get that back, or is that just one of those costs of doing business in 2026?
I'm not sure.
It was a small number.
It's cost to drive by.
That's what I figured. It was relatively small, but it's when it's delineated. At some point, it comes back to someone, but not us. All right, we have a motion and a second on this. All in favor?
Aye.
Okay. Moving on, approval of check request payable to Fine Bersoni Inc. for Smile Politely annual advertising campaign. Is there a motion to approve?
So moved.
I second. Any questions? Okay. All in favor? Aye. Okay. Approval of check requests for multiple county health departments for Narcan distribution for the 4th quarter. Because these are all for the same thing, I'm going to ask for an omnibus to approve. Coles County Health Department, DeWitt Piatt County Health Departments, Douglas County Health Department, Edgar County Health Department, Ford County Health Department, and Vermilion County Health Department, all for Narcan distribution for the 4th quarter. I second. Any questions?
No.
Okay, I have none either. It looks like they're all relatively commensurate to the population of the county served. All in favor? Aye. Okay. Next, approval of requisition payable to McKesson Medical Surgical Inc. for injectable naloxone equipment. Is there a motion?
So moved.
I second. Any questions?
No.
All in favor?
Aye.
Okay. Approval of 9200/1501 revised travel reimbursement policy. approval of draft travel request sheets. First, we'll do a motion and then we'll have some discussion. Is there a motion?
So,
Second. Can you give us a little briefing on this?
Yes, so prior to me coming here, I noticed that when I started, I noticed that some staff under my supervision were traveling, and there was no travel request form, and I suggested that we have a travel request form with destinations, time length, and the purpose of the travel. And usually these are conferences and events. But I just wanted to make sure that we have a documentation in case something happened, that we know who to contact, where they are, their hotel informations, and the events that they are in. I think before it was just coming to me and said, hey, I'm going to this event. So there was no formal documentation. And I think the idea for me is to just making sure that I want to say first that it's not a restriction, because they feel like it sometimes, but it's not a restriction. I wanted to make sure that if there is a travel that is in-state travel, that's approved by a division director. And again, it's just for documentation. If anything happens to the staff, that we have proper documentation to avoid any liability, because they are traveling for the agency in training. So I just wanted to make sure. So that's the first component. So if you're traveling, it has to, if it's in state, it has to be approved by your supervisor, because they know exactly where you're going. So if it's out of state, it has to be approved by your supervisor, which probably is your division director, and then the administrator. So I'm aware if someone is out of state and we know their location. So we review all of this, and I submit this to for Ruth to review it and include any input that she had. But we decided that it should fall under the travel reimbursement policy, because before, when I brought this up to our leadership team, I think there was some, we just wanted to clarify that there was no proper travel request form. So the idea before, what was in place was, when people go to conferences, when they come back, we have a program called Paramount. So they'll go in there and put all their item like their expense, right? So they'll put all their expense, but that's after the event. So my worry is that if something happened before the event, how are we going to know? Because we don't have any documentation proper for that. So I think that's the reason, but we also wanted to make sure that it's tied to the reimbursement policy, because the reimbursement policy clearly states that if you go to a state where the per diem is above the range that's approvable, it has to come to the board. So I want to make sure that both are tied and there's no conflict in between them. I don't know if I make myself clear.
You're making it
Okay.
clear. It seems like a great common sense way of getting the notification in advance and being
Yeah.
able to plan.
Yeah.
And then, 20 years ago in the dark ages, I worked in workers' compensation. Knowing where your employees are sure does make it easier to know what's happening.
Yeah, and for me specifically, I had an experience, I think it was last year when Delta had this cybersecurity event, and their flight got delayed. So I was in conference in San Diego, and we had a huge problem where they didn't know where I was. I didn't know how to do it. So I just wanted to make sure that it doesn't happen, and they know exactly where I am, and I also know where people are when they're out of state. So I think out of state is, for me, is more prevalent than in state, because we need to know out of state where people are, and if something happened, that we can help them and support them.
Great.
So,
I think it's a good thing.
Same. I saw that there were very minimal revisions in the draft that you had here. So I'm assuming that that's the biggest difference you've added on than this travel request.
yeah, because there was no formal travel request. There was
Okay.
no formal. So I just added that, so it's formal now, so, before, I think 2 weeks before you travel anywhere, you have to fill that form, submit to your supervisor. And, again, I just want to give a reassure that if the supervisor approves, there's no way I can say no, because, so I just want to make sure for documentation's sake, if something happened, we're not over our head about trying to figure out where the person is.
That makes sense. Great. All in favor? Aye. Great, moving on. Approval of intergovernmental agreement between CUPHD and the City of Champaign for food service access funding. Is there a motion?
So moved.
I second. Monica, I'm going to ask you again. Give us a little briefing on what we're doing here.
Okay, I'm
We
gonna
approved,
ask.
we approved this
Yeah, we
position
did.
last year, and
Yes.
looks like
So
the
I
City of
think you-
Champaign's going to pay for it now.
Yeah, I'll give a little background. So we applied earlier, I think last year, we applied to a grant with EDPH about food access specialist position. Then we were able to secure 100,000. But the funding with that, with benefits and all the expenses that they need to do to sustain that position, funding is planning to end in June. But prior to that, our division, wellness and health promotion, and some staff from maternal health and child, they were able to collaborate during our food summit with the City of Champaign and realized that there was a funding opportunity and draft an agreement that we can potentially, because there is a need, first of all, but that we can sustain that position and be able to actually do the work that the City of Champaign also want, while maintaining that position. And that would give us some buffer, room to think about what we want to do. But the idea really for us is to maintain this position and sustain that position, because there's a need for this role, and we have seen that during the SNAP. So our staff take, some of the staff here at CUPHD took many roles in trying to convey an event and trying to connect people who have resources but don't know where to serve those resources, so there was a lot of need, and I think the community during the food event, food summit also came together and talked about that need, but that was prior of me being here. But really, we also look at the data, and the data is showing a lot of gap in food access, and we know that there is a lot of opportunity here to connect people who have the resources and the capacity and people who have the needs. But mainly the role of this person is to be a convening role, role like a consortium where they'll bring multiple people, multiple key players in the room and discuss ways that they can help each other and make the progress in terms of targeting those gaps in the community. I had another line of thought that I lost. So this is,
Question. Since it's with the City of Champaign, are the services limited within Champaign, or is it still full county or Champaign-Urbana? Or
yeah. So for the City of Champaign, they will be mainly focused on the City of Champaign. But we also have secured other grants, additional grants with the Campus Community Compact with the University of Illinois and then Lumpkin Foundations. I don't want to take any credit of this, because our Division of Wellness and Health Promotion Director, she's sitting here with me, so she did a great job in securing all those funding. I mean, rock starring all those funding, and we secure all those funding to be able to sustain the position. And but we also took the initiative to bring it to the county board, public health, the county board of public health, just to see if they can help in providing funding. So because we have done this type of funding model before in sustaining our I-plan specialist, so we were in that, mindset of sustaining this funding as we move along, and that would give us all the time and buffer to really put this person in CUPHD payroll, which they already are, but to maintain them.
Was the County Board of Health receptive?
They were very in favor of it. So we have to do some funding logistic, but they are very in favor of it, and we show them data to prove evidence that there's needs. So they are very in favor.
Anecdotally, there is need. When the SNAP crisis came, the U of I Extension had to lay off so many people that were doing this work, and they'd come to the county board asking, like the actual county board asking for some money. We didn't have it for them. We felt terrible. And then we referred them to this building where we knew we had approved this position. So, yeah, there's need. Thank you.
Yeah. I'm glad that you know the background.
Yeah.
I'm glad that you know the background. So thank you.
All right. Well, I'm happy that we found a way to
Yeah,
sustain
we
this and make this keep going.
Yeah, I really want to say that we really thanks the city of Champaign to see the need and really agree on collaborating with us, because this is a very unique way for city government to help each other sustain a position that benefit both party, mutual, beneficial and mutual.
It's great to see that it's not siloed with so many other services in the community.
Yeah.
Do you have any? Okay. All in favor? Aye. Okay, and we have approval. Next, we have a discussion of bylaws for CUPHD. Our packet contained helpful bylaws from the Champaign County Board of Health, and some are applicable. So I guess now we talk about what we want to do. Page 2. Yeah. Oh no, I think I'll let. Yeah. Yeah, so we identified, thanks to a very helpful question from our newest board member, that we didn't have bylaws. And so we're gonna have to make some, and the County Board of Health is a good place for us to start at least looking at them. Obviously, there are some differences, so if we would just wanna go through people holding on to them page by page, I guess, we can, or heading by heading. We can do CUPHD was created by insert that. I'm not sure whose job it will be to do these things. But
I had actually started looking at that, and I apologize I didn't finish the draft, but I think using the Board of Health, County Board of Health as a template makes sense. The statute, County Public Health was created in 1996 when a big group of community activists went. We did I was part of that, but Healthcare Consumers spearheaded that with grant money and did the door-to-door and then successful election in November of '96. So that was created by a referendum. I don't believe that's how CU Public Health, because it's part of statute, or it can be created part of statute, and its authority is under the statute. So there are some changes like that. I noticed there's a place for budget reimbursement for travel for board members, I think, to meetings. I'm not sure you guys are gonna want that, but I suppose that's up to the board to decide. But yeah, if there are suggestions, maybe I would take your notes with you, or you can email me the notes or that sort of thing, and then I'll try to take care of that. But discussing that in an open meeting, I think makes sense. And then I can send out a draft, and then certainly if any individual board members want to call me or email me and say, hey, what about this, I can include that and discuss that, or look up those issues as well as the statutory references and things like that.
Thank you for starting this.
That was Mom, that wasn't me.
Oh. Well, thank you for starting this over here, because it was actually Charlene's question.
Charlene, thank you.
Well, whoever, but the good news is we have time, because there's no pressing oh, you must do this, but we appreciate the work that you will be putting into it, Ruth. A suggestion I have that we'll just talk about in the meetings for members, it's traditionally been Champaign Township Supervisor.
I think by statute it has to be.
There we go. Okay,
So it has to be, I believe that's the case, and I'll look at the language for sure.
But I don't know if it has to be the county board chair, or if it can be a designee.
Right. I think it can be a designee, and then And then there had been an issue with, when there was the executive.
Yeah, so the case law with the
Right.
executive is this is a liaison appointment, so this would be appointed by the county executive.
Okay.
So,
And then if there's no longer an executive.
then it goes back to the county board chair, because the only way for there not to be an executive, we would have to have a countywide elected county board chair with what we have right now. But
Okay.
that's a whole referendum thing. With what we have, is the county board, or the county executive who has to do it, for the case law from about 3 years ago. Yeah, in terms of membership, I don't think we have to have, the staggered 3 year, I think it's just coterminous with the positions. Officers, we've never had a vice president, I don't think. But yeah, otherwise, I think this is a good template, and then, do you have?
No, I would love to go through this a little bit deeper than I already have, and then go ahead and email you with
Yeah.
any updates that are not obvious.
Sure, that would be great, and then, comments aren't limited to board members, so if staff has suggestions, certainly, administrator, and anyone else, who you all share this information with as suggestions, I think those are all worth then, bringing back to you all for the board members to discuss and then vote, to decide.
And then, I know that we had talked about this last April as part of the only time we've had to do one of those administrative hearings. I would love, in my remaining 6 months here, I would love for us to formalize the process so it's in writing in advance of what those administrative hearings might look like in the future. Not that I ever expect us to do one again, but having to have a meeting the week beforehand to agree on the rules, when, like, for clarity's sake, it should just always be, those rules should always be available.
Yeah, I think that makes sense, and to go through, and then with the lessons learned or experience from the last administrative hearing, so that everyone's clear, appellants as well as, board members. I think that absolutely makes sense and something to continue to work on.
Yeah, that's,
Can I
interesting.
add something? So we were, in our leadership meeting, so we were also discussing a policy on cybersecurity. I don't think I shared this with you yet, but maybe I did. So we wanted to have a policy where, as an agency, we do not want to be involved in any ransomware payments. Because we noticed the last time there was some, discussion about it, and it was very emotional. We decided not to do any payment, but, at the end of that meeting, we just came to an agreement that if we had it, a policy, because right now, we don't have any policy related to that. So we have a cybersecurity incident response plan where we have to follow when something happened, but we don't have any formal policy to say that as an agency, we do not want to be paid.
As a policy, we don't negotiate with terrorists. I'll be the first
Exactly.
board member to say that, and we'll get to one other one, and there we go.
Thank you. So we just wanted to put that
We
in
just
writing.
invited-
Also, so the bylaws refer that.
Okay.
In some ways. I
yeah.
don't know if that makes sense.
It makes sense, I'm not sure that that's normally something in the bylaws, that
Okay.
doesn't mean it can't be.
Okay.
And it would seem to be, from my experience when I served on the Urbana City Council, it would be sort of a sense of the council motion.
Mhm.
But there's probably better language for that, and a policy, just a general policy of we don't negotiate with terrorists, we don't pay money to someone who claims to have or does have private information of the district. And we can look at perhaps what others do is always a good idea to sort of give feedback. Also to talk with the experts that we're working with on the recent ransomware to see if they have, with their experience, language or other communities that they've worked with, or public entities, and those policies, to certainly make it clear to everyone that it's the policy and will be the procedure to not negotiate. But I think that's fine.
Yeah, we thought about bylaws because we were like, okay, if it's a policy, they can tell us, oh, we can just change our policy and get, right? We're like, if it's in the bylaws,
Yeah.
right,
It would be like an ordinance, like
Yes,
we're enforcing
yes,
it.
yes.
They're
So-
the strongest
Those are
two.
the like extra steps that we talk about. I don't even know if it's possible.
So I mean, I don't think it's not something, or something you cannot do. I think it's not something I've seen before in bylaws.
Okay.
But it's worth considering or seeing how that works, or if it fits better in a different location. But good to keep that in mind.
Okay.
Thank you.
Right, so for the bylaws, we'll not do anything formally in this meeting today, as it's just discussion, but we look forward to the coming months having something.
I should note, because the next meeting is July 8th, I
You won't
will
have it for July, that's
I won't, I'll be out of the country, so, but I hope I could try and get a draft to y'all, so at least you can look at that, discuss it, and then, continue working on it.
Okay. Well, moving on, there are no pending grant contracts for the administrator to sign, I don't believe. So next meeting is June 8th, July, thank you, I cannot read. July 8th, just 2 weeks from now. 3 weeks from now. And with that, I call this meeting adjourned at 5:36.
Thank you.
Yay! These are very less eventful than.